Geographic inequalities in cardiovascular mortality have been recognized in the US nearly 5 decades ago. Importantly, the NHLBI identified a cluster of 11 states down in the southern United States where there was a higher risk of death due to stroke, and they called it the stroke belt region. This cluster of 11 states included Alabama, Arkansas, Georgia, Indiana, Kentucky, Louisiana, Mississippi, North and South Carolina, Tennessee, and Virginia. Hi, I'm Vibhu Parcha. I'm a fellow in the Division of Cardiovascular Disease at University of Alabama at Birmingham. I'm the first author of the recent article coming out in this issue of Mayo Clinic Proceedings entitled Geographic Inequalities in Cardiovascular Mortality in the United States, a study from 1999 to 2018. We wanted to see if all these decades of effort and public health interventions have had an impact in bridging the gap in cardiovascular and stroke and ischemic heart disease and heart failure mortality between the two regions. We noted that over the last 20 years, cardiovascular mortality has declined at nearly 2.5% per annum in both the regions, stroke mortality at around 2.9% per annum in both the regions, and ischemic heart disease mortality at around 3.8 to 4% per annum. The heart failure mortality declined till around 2012 to 2013, but has been increasing in both the regions. Importantly, the percentage gap in the cardiovascular mortality between the stroke belt region and the non-stroke belt region was nearly 12% in 1999 and 16% in 2018. This was a decline of nearly 7 deaths per 100,000 individuals over the last 20 years. This pattern was consistent across the subgroups of age, sex, race, and urbanization status. Importantly, cardiovascular mortality among young adults has been increasing in the stroke belt. We also projected these deaths and these trends into the coming years, and we found that this cardiovascular mortality gap is expected to persist into the next decade, at least 2025. We need to prevent an additional 100,000 cardiovascular deaths between 2020 and 2025 for the stroke belt to come at par with the non-stroke belt region of the US. The findings from our study are extremely important, especially to the individuals living in the stroke belt regions of the US. We need to improve our understanding to the various barriers for the implementation of guideline-directed medical therapy for the prevention and treatment of cardiovascular diseases. We need to implement a radical overhaul of the current approach, because the public health interventions have not been effective in bridging the gap between the stroke belt and the non-stroke belt regions of the US. A comprehensive approach composed of incentivized lifestyle modification and improved access to healthcare, community outreach, mitigation of barriers for the implementation of telehealth, and targeted secondary and tertiary prevention strategies may help bridge the gap between the stroke belt and the non-stroke belt region. And we need to target and focus our efforts specifically to the rural communities in the stroke belt region so that we can bridge this mortality gap. We should also focus our efforts specifically in the young adult and the adolescent population, possibly by including health education into their school curriculum and college curriculums. The next step in this line for research is to understand the various barriers to implementation of cardiovascular prevention and treatment strategies in the stroke belt region and mitigating the barriers, such as providing an improved access to healthcare through telemedicine, improved healthcare infrastructure, health education, starting very early in life with possible integration into the school curriculum. We also want to understand what the reasons behind the increasing trend for heart failure mortality in the US in both the stroke belt and the non-stroke belt region, and why specifically this mortality gap is nearly 60% for heart failure mortality in the stroke belt region compared to the non-stroke belt. Over the last 20 years, the public health interventions have not been effective in bridging the gap in cardiovascular mortality in the stroke belt region and the non-stroke belt region of the US. A radical overhaul of the current approach is urgently required. The gap in mortality rates between the stroke belt and non-stroke belt region are expected to persist into at least 2025.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.